Tomorrow is our birthday. It's the 1st of July, it's the first year of our existence as a legal entity, and so it felt appropriate to say a few words to mark this. So, as we all know, from day one, our mission has been very clear. We're here to support our residents to live longer, healthier lives, and that mission is only achievable by all of us working together as part of a bold new partnership. And this partnership will tackle shared problems in new ways, new innovative ways. And although it's been a very busy and tricky year, I'm really proud as the chair as to how far we've managed to get in this year. We've been working more closely than ever before, and we've built a partnership that extends beyond those of us who are here today, including other organisations such as the voluntary sector, wider public services, and many, many others. Our board seminars, as you know, have played a very big part in this, as we develop a lot of our strategy in those seminars, and as we know, we are going to be having our first joint strategy meeting with the Integrated Care Partnership in July. We're forging new alliances with our community leaders, one of whom is with us today, and we will be listening to Lloyd Denny later. Charities, even football clubs have come forward to help us look after the population. And we're obviously strengthening our existing relationships. We have signed a memorandum of understanding with the voluntary sector, the VCSE, and this has laid the foundations of how we're going to work together over the next 5 years. And as we will see today, we've also got a memorandum of understanding that we are developing with our 4 health watches that will, again, put the foundations of some important work with our valued partners. We're putting the voice of the resident into everything that we do, and that starts here at this board, where we're going to listen to both the resident story and also look at how it stretches across all our work with Health Watch through to the delivery of co-production training that we have rolled out to 300 staff. We're making great strides in driving innovation. We're using a lot more new technology to revolutionise how we deliver our care. And many of those stories speak for themselves. So, for example, the parents of children with epilepsy in Luton can now use tech to help them take their first holidays in years. And that tech is a new tech in social care is also reducing hospital admissions in Milton Keynes and across all our places. Nominations have reached the finals of last week's HSJ Digital Awards, and that just scratches the surface of all the work that's ongoing. And we're very proud that our SHINE programme, that was a digital approach to support staff and patient wellbeing, won at the Integrated Health Awards 2023. We're also setting up many new research partnerships as we want to become a research ICS. And so, for example, we have worked quite closely with the University of Bedfordshire to develop a research centre that will focus on new ways to tackle inequalities. And the Denny Review, which we will hear a lot more about later, gives us a lot of the evidence that we need to be able to take decisive action to make sure that health outcomes are not unfairly determined by either ethnicity, sexuality, or socioeconomic backgrounds. Our focus on the determinants of health have obviously pushed us much beyond where the NHS operates, which is why our partnership together really matters. Our work in Bedford have supported 500 young people to build self-confidence, resilience and communication skills, and that's an example I'm particularly proud of. Today we will need to rise to the challenges that we know will face us in the years ahead, such as supporting the needs of one of England's fastest growing populations, and yet we still have limited resource. More immediately, we must make sure that the full force of our collective efforts as a board are focused on the biggest issues that we face today, which includes ensuring good access to primary care for all of those who need it in the face of rising demand, and those who are listening to Radio 4 will have heard our Secretary of State talking about this morning. Making sure that our health and care workforce is fit for the future, and obviously the long-term workforce plan that's being published today should help us with that. Reducing our elective waiting lists, which have had a direct impact on primary care demand. So I want BLMK to lead the way in demonstrating how working as an effective and integrated care system drives real progress in these areas and the tangible impact that it has on our residents' lives. We also need to keep getting better at working through the immediate day-to-day issues, such as our challenges estate. And I'm proud to see how some new facilities, such as the Integrated Health and Care Hub in Dunstable, are bringing partners under the same roof, which is going to give us an opportunity to work differently, together, co-located, in a place that our residents can reach us all together. And finally, I want to thank all of you for the part that you're playing in the ICB, and I look forward to supporting our board to continue to develop the benefits for all our residents across BLMK.